I thought you were going to mention the trial lawyers advertising billboards. I know we've had enough of that. We really not looking at that. But
Right. I think the filter here is just what you spoke to. We cannot, or physicians cannot prescribe because this is a Category 1 drug. So we can or physicians can recommend and then give them the card so they can go access. So public awareness, is one thing, but it's still the gatekeeper is going to be the physician in this, and which will require an exam. I don't know any physician that you just call them and say, I want a card. That's not going to happen. Okay, we have some other questions here. Representative Clark.
You mentioned the low numbers of people who are actually using the program, and I'm curious how some of these things are going to, I guess, increase the number of people. But my question actually has to do with the Medical Cannabis Commission. They are allowed now to do public awareness campaigns on this. And it also mentions that they are able to do this for the public, but also for law enforcement and healthcare providers. And I guess my question is on the law enforcement part. What exactly are we trying to make the law enforcement aware that it's okay for people to have this cannabis? Like, how are we, what is the awareness for them specifically?
The bill really addresses that. I think what you're talking to, just clarification that this is product is protected from the controlled substance. It's not changing anything, but just clarification. And it doesn't change how medical cannabis is classified, but just trying to some clarification of that. I think many folks are concerned when they get the card and have a possession of this product. Just make sure they are legal with it. We've allowed it nationally. I mean, it's that they can do anything they need to do. No restrictions on it if they've got the card with this approved product from the commission.
All right, thank you.
Okay, Representative, who we have now, Schofield.
Thank you, Mr. Chair. Like the bill, with the exception, I'd like lupus to be added. Lupus. I would like lupus to be added in this.
Lupus.
Yes, this was. I know I had worked with them years ago on this, and it was omitted. And at the appropriate time, I wanted it added back in.
Are you asking for an amendment?
Yeah, I'd like an amendment, please, to include lupus.
Okay. Okay, Representative Douglas.
Yes, thank you, Mr. Chair. Mine is on a lighter note. I think this is a great bill, Mr. Chairman. Next time you come, like you have done in the past, with your peaches, I think it would be apropos if you bring some good. You get it? Yes, it's just some samples for the committee.
The gentleman knows where he's
weigh in totally on this bill. On the peaches, yes. We just want to weigh in and make sure that the people are getting what prescribed for them in a good social way.
Well, you know what you talk. You're welcome to come back and pick peaches again. You've been to my farm one time to pick peaches.
Yes, sir, absolutely. But I think this is a great bill for the committee who don't know that being an ex-athlete, our bodies go through a lot of trauma. It's not like the trauma that these kids are going through and sustaining to on a day-to-day basis. But instead of taking those opioids, I think this is a great method of treatment to keep you off of that, to get something natural in your system to help you balance out and to come back to present state where we won't be addicted to those opioids that are so killing our nation right now. So I thank you for this bill. Thank you.
That's a great point, and that is really one of my reasons for bringing this bill.
Thank you.
Thank you. Representative Clark.
Thank you, Chairman. Just want to say thank you, Chairman, for carrying this bill. Know back in 2015, there was a lot of work put into it to get to where we are today, but really helping the patients. And I know they had the patient listening tour that went all over the state, and it was at different universities throughout the state, and they listened to, I know, something like over 100 patients, medical and health professionals who spoke on that. And I think we've done a lot, but then we haven't really had legislation that's really put patients first. Right. And I know also, I know there's a question somebody asked, about the data of those who had taken it. One thing I think on the cannabis, there's a stigma, but I know from when we passed in 2015, the majority of patients are 50 and older. So it's not, you have these young people trying to get on this to go get high. I mean, you can go smell in the streets. I mean, if you want to do that, then you're going to go another route. I mean, these are patients who are really wanting help, who have tried a lot of things, and so thank you for doing that. Means a lot. So
thank you for those
fully in
comments.
support of this legislation.
Chair Lady Cooper.
Okay. All right. I have a couple of questions. Okay. And
I hope I can answer them.
okay. And a statement. I think what we're seeing and why did a group of patients come and ask you for this bill, or did a group of doctors that are subscribing come and ask for this bill?
No, ma'am.
Okay. I think what we're seeing is a bill that's being pushed by the producers. Mm-hmm. When we did this, just going back, mm-hmm. one of the things that I said at the time was, when they said there were going to be 3 and 3, all these different kind of producers, was they were saying they could produce so much product that there weren't going to be enough patients to use it. Mm-hmm. And that's what we're seeing. You have these companies that were approved, and they put all the money in it, and now they're finding out that they really can't sell enough of it to make it profitable, which would certainly go to, we should not ever expand it to other companies to start producing in the state. So I think it's being pushed by them. So that would make me, and I think maybe as you look at it's not advertising, there's no definition in here of awareness. And you know how lawyers like to get into our bills, and companies says, well, it's awareness. It's not. We're just putting the television ads on because we're just doing awareness. And that really bothers me because I think we're opening up for advertising. Mm-hmm. Okay. And the other thing I have, a question. On line 124 in it, it says medical cannabis are a product or products containing an equivalent amount. Okay, I understand that about the equivalent amount. But could that ever be a cigarette? Is it open? A product? I mean, I don't have any idea how you make cigarettes or how you get the product in, but a cigarette would be a product.
Yeah.
So could we have them say, okay, there's the opening in the law, which the governor was against, and all of us pretty much at the time said we didn't want to go that route. And that worries me. It also worries me if it's products like gummy bears. In Colorado, and there's been studies post-op, they're having a terrible time with children going to the children's hospital because parents get high, and there are children that can eat the brownies or the gummy bears, and they're ending up in the emergency room. Because, well, why wouldn't a little child, want to eat gummy bears left over? And they're also, not only are they having it there, believe it or not, but they're having, the vets are getting more animals because apparently lots of animals like brownies and that kind of thing too. So that really concerns me about the bill, is that the products is so open, but especially if that could open it up to cigarettes.
My understanding is hopefully this bill, Madam Chair, does not change the products. I think that is in code. I don't know if we got somebody from the commission here. I think my intent was not to change any products at all of what is allowed now. And I hear your caution, and I don't disagree with you.
Would there be some way for us to change that?
We could let council do some research to make sure. But my understanding, this language did not change definition of any product.
And maybe the awareness, get a definition of what awareness
Yeah,
is.
we could work on that.
So
Okay.
that,
Representative Kelly, I think you can shed some light on this. Go ahead.
I kind of had the same kind of concern as what would be a product. And so I went back and tried to cross-reference some of the references on, so the first line, 216, it says hemp product shall have the same meaning as code section 223.3. And so when I pull 220.23.3, I'll just read it for everybody. It says, means all hemp products means all products with the federally defined THC level for hemp derived from or made by processing hemp plants or plant parts that are prepared in the form available for legal commercial sale, but not including food products infused with THC unless approved by the United States Food and Drug Administration. So I think there's a federal check on what the U.S. FDA classifies as an eligible product. I think that may address part of the concern there of whether they would allow it to be classified as a cigarette. The second area is we do define product later as it relates to low THC oil. Now medical cannabis product means on 229 delivered through an oil, tincture, transdermal patch, lotion, or capsule, except as provided for. So that I shared some of your concerns, and I got cross-referencing a little bit, and that made
Thank
it.
you.
Thank you.
is there a possibility of adding in the definitions awareness, a definition of awareness? Or, or what we mean by advertising? Because I'm with Dr. Newton on that. I mean, I believe they ought to take all the ads for medicines off because your patients go in demanding it. And having had a husband and been in the room with him when patients were demanding a certain pill, I mean, they get really bad, and it's not always what they need, and sometimes it might be that they might not need to have this medical marijuana, but it's
You're
pretty
asking
open.
good questions. Representative Kelly's got a comment on that one, too.
I want to ask. I want to ask because I want to make sure we're talking about. You're looking at section 3.3, where we're talking about what the actual Cannabis Commission can do. Correct? Because that's where I see awareness. It relates to line 243, and it references back to what are the responsibilities of the Georgia Access to Medical Cannabis Commission. And it said that this would allow them to engage in public awareness activities concerning the medical cannabis program. I think, and then it goes to say that could be, include, not limited to, publishing materials and conducting outreach and public activities to inform, that as we run through 243 to 248. And so that is, I view that, at least, and I've been wrong up here a lot, but I read it to mean that we were talking about the actual commission. If there was any, kind of public awareness or call it advertising campaign, it would have to be initiated through the commission. But then on the page right after that, on 268 going through 271, the producers of the oil or the medical cannabis, they can only directly advertise to physicians and healthcare providers. They can't. The producers can only, and to the author of the bill, that was my concern, or my question is, direct advertising by the producers only allowed to physicians and healthcare providers, and the only ones who can advertise to the public or make the public aware would all be driven through the commission. That's why I guess I was trying to get clarification on too.
Representative Clark.
Yeah, thank you for that. I think the confusion is line 274.